Hello students, today we will see introduction of semen. So what is semen? It is fluid containing sperms produced by testes and secretions from seminal vesicle and prostate. So composition, the color of the semen is grey white, pH it is alkaline, and the portion from the testes it is sperms, usually they are 100 million per ml. From seminal vesicle it is fructose ascorbic acid, from prostate it is citric acid, cholesterol, phosphatic acid, fibrogenase, hyaluronidase. So these are the composition of the semen. And uses of semen analysis in a infertility of a patient couple married more than 6 months and they are not having any issue. So that time first investigation we do is semen analysis, and it can be used sometimes for the gonadal function test. Thank you. Usually sample collection, it is recommended sample is semen after 3 days of period of abstinence, that is no sexual contact for 3 days, and most satisfactory sample should be collected in laboratory so that we can test it immediately. Such tests like liquefaction time, coagulum formation, viscosity. Thank you. Hello students, now we will see physical examination of semen. So after collection of semen, wait for half an hour and then take the readings. Like color, normally it is greyish white. Volume, it is around 3 to 5 ml. Viscosity, that you have to do by taking semen sample after half an hour, that is after liquefaction time, into the pasture pipette and allow it to go drop by drop. If it is going drop by drop, then it is normal viscosity. If it is not going drop by drop, it will form a line of string from the pasture pipette, then it is increased viscosity, and increased viscosity may be the reason for infertility. Liquefaction time means after collection of sample, it is usually coagulum, and then after 30 minutes, that is half an hour, it liquefies, that is called as liquefaction time. Thank you. Students, we will see chemical examination of semen. So in that two tests are done, that is first is pH, that is done by pH paper, and normal pH of the semen is alkaline. Second test is fructose, so it is done by taking resorcinol reagent in test tube and then add semen and boil it like Benedict's test and then wait for 5 minutes. So if red precipitate forms, that is it is fructose present, and if no change in color, that is light red color, it is fructose absent, and usually it is seen in infertility. Thank you. Hello students, now we will see microscopic examination of semen. So in that first is the motility of the sperms. So for that you have to take one drop of sample after liquefaction on the slide, put cover slip and then see the motility, and average you have to count 200 sperms and then observe the motility in percentage. The report is given as actively motile, the sperms which moves very fast; sluggishly motile, the sperms which moves the side by side only; and non-motile means non-moving sperms. So normally more than 60% sperms are actively motile. Second test is determination of sperm count. So this we have to do the dilution in WBC pipette of 0.5 mark semen sample and 11 mark semen diluting fluid as we do in WBC count. Then wait for 5 minutes, then mix the contents, discard few drops, then load the chamber and count sperms in 4 corner squares, that is WBC squares, and then you have to count the formula like number of sperms is equal to 50,000, n into 50,000, and then normal range is 40 to 300 million sperms per ml. Azoospermia when no sperms are seen, oligospermia when less than 40 million sperms are seen in a count. So it is significance for the infertility. Then third is morphology of sperms. So you have to make a smear like we do in WBC DLC blood smear, and then stain it by Leishman method and see the morphology. So in this slide you can see normal morphology, that is head, middle piece and tail. So the abnormal morphology, you can find head defects, double head, small head, big head, or middle piece defect, that is no middle piece or double middle piece, or tail defects like rudimentary tail, long tail, curly tail, or no tail. So these are the abnormal forms of sperms, and if they are more than 15%, then it is may be causing infertility. Thank you. I hope this session you will find useful. Thank you.